My name is Sabrina Farina. I'm a social worker at Gulf States Hemophilia and Thrombophilia Center in Houston, Texas. Gulf States Hemophilia and Thrombophilia Center has been here for 30 years serving our patients with bleeding disorders. Today we'd like to focus on providing information to healthcare professionals who specialize in aging on a national level. We'd like to let you know how we serve our patients and see how we can work collaboratively together in the care for our patients. Dr. Miguel Escobar is the medical director at Gulf States Hemophilia and Thrombophilia Center.
Yeah, Sabrina, as you mentioned, we have a new generation of hemophiliacs, aging individuals, which I think is very important, especially when they make that transition from the home or from a hospital to a facility. As we know, hemophilia is a chronic bleeding disorder, so these individuals are at risk of having bleeding complications. And I think it's important to be able to communicate with the staff in these facilities to be able to provide education about what are the possible risks and complications that these patients can have and how they can take care of them in these facilities. We have different degrees of severities of hemophiliacs. These patients can have spontaneous bleeds, they can have bleeding with trauma just from a simple fall, or they can have bleeding during or after surgery. So I think it's important to be able to provide that information so they can give the best care to that population. Collaboration, I think, is very important. So once a patient is in a facility, it will be very important for us or for them to communicate and be able to provide their history, especially their medications. I mean, there are some medications that could make some of these patients with bleeding disorders have some bleeding symptoms. And we are aware that older individuals have comorbidities and are sometimes in a lot of medications. So it will be important to know things as simple as taking aspirin or taking non-steroidals or other medications that can make him bleed. Also, certain procedures might be, they need to be done with caution. Things like phlebotomies or even physical therapy sometimes. Some of our patients might need to receive factory infusions before they have certain procedures because there's a risk of bleeding. Now, if these patients are going to be transferred from one of these facilities to a hospital, then I think it's important for us to know so we can have continuity of care wherever these individuals go. I think that is the first probably avenue that we have to take, where they can call and they can discuss the patient, like you said, with one of our nurses, or even with a social worker, with a physician, with a physical therapist, since we have a comprehensive team that we're pretty much very familiar with our patients. Our patients get the same comorbidities as any other individual. So they're going to be at risk of having falls or having many other diseases. And patients with bleeding disorders, especially hemophilia, when they have a fall, initially they might not present with any symptoms, but within hours or within a couple of days, they can present now with some evidence of active bleeding. They can have internal bleeding, they can have bleeding inside the brain, they can have bleeding into a joint, into a muscle. That in somebody that doesn't have hemophilia might not be maybe a big deal, but in somebody with a bleeding disorder, it can become a big complication. Even those individuals can, have a high risk of even mortality if are not taken care of. So I think it's important when one of our patients has a fall to be able to do the right assessment. So depending on the type of fall, sometimes they have to go to an emergency room. They might have to get special testing, CT scans, MRIs, X-rays, to make sure that they don't have any internal bleeding that can complicate the issues. And I think it's also very important to be able to provide with factor these patients on there in their certain facilities, because if somebody has a fall, I think it's important to be able to infuse them right away. Instead of waiting and see if there is a bleed, it will be better recommendation to infuse them, and then after that go ahead and do the appropriate studies. But at least to try to prevent a bleed or a complication. I think that, dental care, like any other procedure, I think should be done, with caution, and that's why it's important that communication between the facility and our hemophilia treatment center. Because a simple extraction or a simple procedure can really become a big deal or can end up with a big complication in a patient with hemophilia. So I think it's important for the dentist or the hygienist or the oral surgeon to communicate with the hemophilia center every time they're going to do a procedure on one of our patients, even if it's a simple procedure. Because the majority of the times they're going to require some sort of replacement, either with factor, with an antifibrinolytic, or any other type of medication to prevent any complications. So I think it's very important, again, to have that communication, to be able to give them the right guidance to prevent complications with our patients. I think collaboration is the most important thing, that communication between the different facilities. The model that we practice is the comprehensive model, where we have staff that is specialized taking care of patients just with bleeding disorders. So I think it's important for them to take advantage of that, where the other facilities can communicate with us, they can talk to us, and we can provide the right guidance so that we can avoid complications in our population.
Thank you to the National Hemophilia Foundation for the funding of this video. On a national level, we'd like to encourage families with bleeding disorders to take this video with you to a facility where you're planning to have your family member reside, an assisted living facility or a long-term care facility. And to the healthcare professionals who work in the aging field, please feel free to reach out to any of the hemophilia treatment centers nationally.